Good afternoon, everybody. My name is Peter Zanoni. I'm Corpus Christi City Manager. And today we're here to conduct our joint Nueces County City of Corpus Christi health briefing on COVID-19. Excuse me. And with me today should be our Public Health Director, Annette Rodriguez. Our mayor is here, Mayor Joe McComb. And we think Judge Canales should be arriving as well. So we'll have 4 presenters today. And I will do an update on the COVID statistics, specifically what has transpired in the past 24 hours in terms of new COVID cases and recovery rates for those that have had it. We'll also show you some trending analysis on number of cases per day and number of tests per day using a 7-day rolling average. And then our Public Health Director, Annette Rodriguez, will talk to us about the state-ordered testing at nursing homes, talk about how that's coming along. Mayor Joe McComb is here. He's going to give an update on these press briefings in general. We're going to begin to change the routine a little bit here in the near future, beginning next week. And he'll have a couple other comments maybe on some of the big mayor work that he's been doing out there with other mayors in the state. And Judge Canales is scheduled to be here. She'll give a little bit more information on the governor's orders. I spoke on her behalf yesterday, providing an update on what the governor did statewide, and the judge reciprocally will adjust the county's orders to reflect the governor's orders for the state. Okay, so we want to thank the media for covering this today. We know that KIII and Chris 6 and the Caller Times cover it for the community. We show it on our Facebook page, the City of Corpus Christi does. We also show it on YouTube and our channel, and so we appreciate the folks covering it. We also appreciate the people watching. It's important for you to get good information, and it's important for you to share the information with your family, friends, neighbors, and other folks that you know. Okay, so let's begin with the statistical update. And so every day at 4 o'clock, regardless if we're here presenting or not, we update the data and we present it here, but we also place it on our website. There's a very nicely done interactive portal or summary page on our website, a dashboard, I guess is what we call it, that shows statistics on number of cases, recovery, and so on. There's also maps on there that show a number of cases by zip code, and a lot of other information that we actually don't show here is there on the website. So since yesterday at 4 o'clock, we have 6 new cases for Nueces County. And you can see in our graph here, it was not too many tests done admittedly over the weekend, but we had 2 and 1 on Saturday, Sunday, 8 yesterday, and then 6 new cases confirmed for today. So that brings our total, since we have been counting, up to 248. And just about 50% of those are recovered, and we'll show you that graph here in a little bit. But 248 cases since we have been tracking this over the past 2, close to 3 months. There's been 3 deaths in Nueces County because of COVID-19. When we look at the distribution of the cases by gender, the male distribution of the number of males that have cases is a little bit greater nowadays than the number of females. And that's been kind of the trend nationwide, and Annette was telling us recently. So 58% of all the cases are male, 42% are female. Today's additional 5 were in the male category, and 1 was in the female category. And then we show the statistics of 248 against 9 different age groups. So we show where the cases are, and it's been a long reporting statistic that the ages are pretty. They distribute pretty consistently across all age groups. So the 248 are not in one particular age bracket or another. They're pretty evenly distributed, with the majority of the distribution being in that 20 to 69-year-old bracket. But there's some in the 0 to 19. We have 6 in the 80 to 89-year-old category and 1 in the 90-plus category. And then when we look at number of tests, today between the city, the state with their National Guard, and the private hospital clinics and physicians that have ordered tests, we've done just under 300 tests here in the county, so 298. That brings our total testing done in Nueces County by all means, the city, the National Guard, and commercial labs to 7,036 total tests performed. Let's look at the our donut here that we referred to. This shows recovery rates and puts into perspective the total cases in terms of who's recovered and who still might have it. So as you can see, the majority of the cases are still in the active case, 130, but it's not too far away as the recovered cases at 115. So of the 248 cases, 115 have recovered and 130 is still active. That 115 recovery rate is about 47%. And we do have 3 persons that have died, and that's on the graph as well. There are a total of 5 persons in the hospital. There's 1 more since yesterday. Yesterday was 4, so we have 1 additional person in the hospital and 1 additional person in intensive care. It was 2 yesterday. Today, I'm sorry, it was 1 yesterday. Today it's a total of 2 in intensive care. So a total of 5 in the hospital. So that shows our stats there. And then when we look at location, the community has wanted to know about that. There's, of the 6 new cases today, 5 were in the city of Corpus Christi. So that total for Corpus Christi now is 223. There are 4 in Robstown. That 6th person was in Robstown. We have 11 in rural Nueces County and 1 in Agua Dulce, 1 in Bishop, and then 1 in Driscoll. So those all total up to 248. Okay, and then we have our 2 trending graphs. So this shows, the first one shows the number of tests and the running 7-day average. You can see that we've steadily increased the number of tests performed on a 7-day running average. That's this red line. And then the blue bars show you the number of tests performed per day. So the 7-day average, running average of tests performed is about 300 tests, just a little over 300 tests performed per day. And this graph is showing us the number of cases, number of active cases, and you can see that it's declining here recently. There was a big spike from 2 outbreaks, we know, our beef processing plant, as well as 2 transitional homes caused a big spike over the last week and the weekend. Or the tail end of last week, I should say, or a good part of last week, and it's dropped down now in the last couple of days. But the average running day total, when you look at a 7-day running average, is 10 cases a day. That's what we've been averaging because of that big spike, primarily. Okay, so that's the statistics for today, and at this point, we're going to get it translated into Spanish, and then Annette Rodriguez, our Public Health Director, will talk to us about testing in our nursing homes.
Las cifras más recientes indican que en las últimas 24 horas se han reportado 6 casos confirmados por el coronavirus, haciendo un total de 248 casos. 145 son hombres, 103 son mujeres. La mayoría se encuentran en el rango de edades entre 40 y 49 años. A la fecha se han llevado a cabo 7,036 pruebas por el virus entre el Distrito de Salud Pública, laboratorios privados y la Guardia Nacional. De los 248 casos, la mayoría son casos positivos residentes de la ciudad de Corpus Christi. 4 son residentes de Robstown, 11 son residentes de áreas rurales. 115 de los 248 casos se han recuperado por completo. 5 personas continúan en el hospital. 2 personas se encuentran en la unidad de cuidados intensivos. 130 casos aún continúan activos y a la fecha se reportan 3 fallecimientos.
Good afternoon, Annette Rodriguez, Health Director. So if you have symptoms of COVID-19, you can still contact the military testing team at the 512-883-2400, as well as the website, thetexascovidtest.org. If your results are negative, the military testing teams will contact you. If they're positive, the health district will contact you if you live in our jurisdiction in Nueces County. The health district continues to test the nursing homes currently. We are working with the fire department, which is the one that's actually doing all the swabbing for the residents and for the staff. And then the health district is doing some of the analyzing, as well as Christus Spawn. So Christus Spawn notified us today that they have more cartridges, so they will be testing again tomorrow and analyzing those tests. So tomorrow and then on Thursday, the health district will resume the testing. On on Thursday and Friday, and then maybe spawn again on Monday. With the reopening of child care centers and youth clubs yesterday, it's an appropriate time to share an alert that the Centers for Disease Control released last week on May 14th. This health alert is in regards to what's called multi-system inflammatory syndrome in children. It's associated with those that are positive with COVID-19. This alert stems from reports from England and New York that showed a significant amount of cases of MIS, the multisystem inflammatory syndrome, in children with COVID-19 positive. They have what looks like Kawasaki disease. The features of Kawasaki disease are fever, rash, swelling of the hands and feet, irritation, redness in the eyes, swollen lymph glands in the neck, and irritation and inflammation of the mouth, lips, and throat. The symptoms of multisystem inflammatory syndrome in children include constant fever, low blood pressure, and other multi-organ syndromes and inflammation. This is an additional complication that is being reported in individuals under the age of 21 that are positive for COVID-19. Again, we continue to advise the public to practice public health strategies such as good hand washing for at least 20 seconds, avoid touching your eyes, nose, and mouth with unwashed hands, wear a mask when you're out in public, especially if you're in areas that have high congregate settings, and disinfect frequently touch surfaces. Remember that these behaviors will help in the fight against COVID-19. Stay safe, stay healthy, and as always, stay informed. Thank you.
En resumen, si cree tener síntomas del coronavirus, comuníquese con el equipo de pruebas militares al número 512-883-2400 o al portal textcovidtest.org. Si sus resultados son negativos, el equipo de pruebas militares se comunicará con usted. El Distrito de Salud solo se comunicará con usted si sus resultados son positivos. Continuamos realizando la toma de especímenes en asilos de ancianos gracias a la ayuda del Departamento de Bomberos. Ayer el gobernador anunció varios negocios y actividades más que pueden reanudarse y reabrirse de inmediato, como guarderías, clubes juveniles y servicios de cuidado personal, así como servicios de belleza, salones de masajes, estudios de tatuajes y estudios de piercing. Con estas reaperturas es importante recalcar el síndrome inflamatorio multisistémico en niños asociado con el coronavirus. Esta alerta proviene de informes de Inglaterra y Nueva York que mostraron una cantidad significativa de casos por este síndrome en niños con características similares a la enfermedad de Kawasaki, como fiebre, erupción cutánea, hinchazón de manos, pies, irritación y enrojecimiento de la parte blanca de los ojos, ganglios linfáticos inflamados en el cuello, irritación e inflamación de la boca, labios y garganta. Los síntomas incluyen fiebre, presión arterial baja e inflamación de múltiples órganos. Continuamos aconsejando al público que continúe practicando estrategias de salud pública.
Thank you so much. Good afternoon. Barbara Canales, Nueces County Judge. Well, yesterday, Governor Abbott issued an executive order to initiate Phase 2 of the plan to open Texas. And while I was not here with you yesterday, you got a good rendition. We watched from Manager Zanoni, and I think he did a great job of explaining, but I thought it'd be a good idea to go ahead and highlight, just based on the emails and the volume of texts and calls that I received today. There's just always so many questions every time we pivot and make a change. And so today I issued an executive order from the county aligning our guidelines with the governor's order. I always think this is important because I think people want to know how structure really develops. And of course, the powers flow from emergency management from the governor to county judges. So when the governor pivots, we do too here in this county. That's been the tempo ever since day one. I think it's provided consistency and strength. And we thank the governor for his leadership. The majority of the changes in Governor Abbott's orders go into effect Friday, May 22nd or afterwards. And again, the major item under Phase 2 really focuses in several areas that we've already gone over, but let's talk about restaurants. Restaurants can increase their occupancy to 50% beginning May 22nd. And of course, as I go over these, I want to provide anecdotal information because I think it helps. Because I'm just like you. I'm dying to go have a wonderful meal at one of my favorite restaurants, and I want to patronize those restaurants that are doing it right. So I want to thank all of the hospitality, the Texas Restaurant Association, all those servers and bartenders and everybody that's been sitting, waiting patiently for this day. And now the way we can give thanks back is to do it right. So thank you to everybody who's a part of getting phase 2 underway. Bars, including wine tasting rooms, craft breweries, and similar business can open at 25% occupancy. But like restaurants, these occupancy limits do not apply to outdoor areas that maintain safe social distancing among parties. And I've already been partaking this past weekend of some of those great patios, and I know you will enjoy them too. Many other services and activities that remain closed under Phase 1 may open with restricted occupancy levels, and minimum standard health protocols are laid out in the Texas Department of State Health Services. You always hear me refer to DSHS. That's what that is. That's the Texas Department of State Health Services. Now you can get the lingo too. That's DSHS. It's one of the most important agencies we have throughout this COVID-19 response, and they're the ones that maintain these protocols for us. So if you're writing some information down, I think these are the highlights, at least as I've seen them. May 18th, in addition to gyms, we're going to have child care centers, massage and personal care centers open, as well as youth clubs. May 22nd, by the way, that's this Friday. That was rodeo and equestrian events, bowling alleys, bingo halls, simulcast racing and skating rinks, bars and wine tasting events, and aquariums and natural caverns. May 29th, zoos. We don't have any zoos here, but if you're planning on attending one, May 29th would be that day. And May 31st, this is going to be important to so many families, and that's day youth camps, overnight youth camps, youth sports, certain professional sports without in-person spectators. And all sporting and camp activities are required to adhere by special safety standards. So you shouldn't worry that if you're going to go and participate that they're subject to any less of the high level of safety that is required everywhere else. These health protocols have been established for all the newly announced open services and activities. And here's a big one. Businesses that are inside office buildings may also open, but they're going to limit their occupancy to the greater of 10 employees or 25% of their workforce. Now, all of a sudden, you can kind of feel downtown coming alive, right? That's what we're talking about, those businesses inside the opened and businesses that are inside office buildings. And additionally, the governor announced public schools in Texas have the option to provide in-person summer school so long as they follow social distancing practices and health protocols, again, laid out by DSHS. And these can start on June 1st. And our schools, just to be clear, have not made any of these local decisions at this time. So all of this is regarding services and activities in Phase 2, and I want to emphasize to everybody that the details and the guidelines are available on www.gov.texas.gov/OpenTexas, and this will be available to you on all of our websites. And I want to stress these protocols because, again, as I said earlier, I get a chance to get a really an opportunity to hear from all of you through emails. And today I was trying to get back to a gentleman who has asked very good questions about gyms. And I think that so often we patronize places and they've done a great job of putting their guidelines up, but then all of a sudden there could be a gap and there's no guidelines for individuals. And so the individuals also need to make sure they understand the guidelines. So there's guidelines for you, and there's guidelines for the businesses. And so while they're published online and we want you to go to the website, just remember if you have questions, until there are no more questions, we're going to keep answering your questions at 414-6000 or at 888-0444 or at county.attorney@noisesco.com. And every time these rules change, you need to know that your county is there for you so that you can get these questions answered. And so the rules under which businesses operate and which individuals must take personal responsibility are all provided for you in this amazing checklist, if you will, that's given to us by the governor's office. And so if you encounter a business which is not following the checklist, you may say, hey, have you seen these guidelines? They're available online, and point them to these guidelines. I think that we've always said, let's education, the way to best enforce a good rule that's in the best interest of public health is not getting after somebody or throwing the book at somebody, it's educating them. So I want to stress that. So thank you, whoever you are today, at the constituent who was at that gym and called me and told me the gym staff basically had only received part of the instructions. You helped that gym maintain public safety, and I think we're all better for it. So thank you for the education and not the enforcement aspect. I'm particularly intrigued by this constant quest to test, and we're doing such a good job of that here in Nueces County. I'll also tell you that we have been excellent in our advocacy as a collective group, city, county, legislative delegation, and our associations with our city county health department and Krista Spahn. And because of that advocacy and because of Krista Spahn's relationship with CEFID, 100 cartridges representing 10 tests per cartridge, or a total of 1,000 individual tests are headed our way by FedEx, should be here latter part of the week. Because of that, we're able to test local. We need to be able to test local in order to return those results as fast as possible. Why? Because when those results come in, we're able to isolate and protect and reduce the further spread of this virus. I want to point out that today there was, I think, over 130 people who tested in Port Aransas, so thank you to the Guard. And I believe on Saturday they'll be in Flower Bluff, and you'll keep seeing this MMT testing throughout, and we're very, very grateful. I also want to say that I am completely aware, and I thank you for all of the information you have sent to me about how long some of these test results are taking to come in. Let me say I acknowledge, I hear you. I too am completely frustrated. What I can tell you is that we have a heck of a highway system, and that's the Guard, absolutely swabbing and testing in so many areas all over Nueces County. But what's happening is we have a traffic jam on that beautiful highway. And that traffic jam is all these tests coming in all over the state at the same time. We are doing everything we can locally to work with our state representatives and with dishes to say, we'd like to stand up and offer our services from our regional lab and from the Krista Spahn CEFID Gen X Infinity system to be able to test here locally, getting results for not only Nueces County, but for our region. As I've always said, I want to lock in our gains. We have given up too much to go back. I want to thank everybody for being able to spread our message yesterday as far as how important it is to continue all of the things that we have preached for so long. And you might wonder, when are we going to stop preaching? When are we going to start enjoying again? Well, I think that part has started. But are we ever going to go back to the way it was? Perhaps. But for now, and really for months to come, there is no doubt that there is no going back, there is only going forwards. Locking in this gains means remembering and creating muscle memory so that you can make those masks almost disappear. You really need to make sure that you keep vigilant because we need to make certain that we do not repeat the mistakes that we all know happen when you drop your good sanitation practices, your disinfecting practices, your hygiene, and most important, your social distancing. There might be temptations as we continue our phases to reopen Texas. Let me remind you that there were many counties, not too many, but enough, that more than on one hand, that could not open. They could not enjoy phase 2. And the reason is because they have hot spots. Let us never be in that scenario. Let us stay vigilant. Let us stay proactive. I absolutely love when Director Rodriguez says, stay safe, stay healthy, and stay informed. The orders now are from your own household. You get to be the county judge of your own home. Execute those orders. Believe in them. Know that they'll keep you safe and your family safe. And when you do, your community will be better. Thank you, and I'll see you on Thursday.
En resumen, el día de ayer el gobernador firmó una orden ejecutiva para la reapertura del Estado en la fase 2. El día de hoy yo firmé una orden ejecutiva que va a reflejar las órdenes del gobernador. La mayoría de las órdenes entran en vigor el día 18. Los restaurantes podrán reabrir sus comedores al 50% de su capacidad el día 22 de mayo. Los bares también podrán reabrir al 25% de su capacidad, así como viñedos, excepto en áreas que se encuentran afuera, siempre y cuando haya un distanciamiento social. El 18 de mayo podrán reabrir las guarderías, clubes juveniles, salas de masaje. El 22 de mayo, rodeos, eventos ecuestres, boliches, salas de bingo, pistas de patinaje, bares, restaurantes al 50% de su capacidad total, acuarios y las cavernas naturales. El 31 de mayo, los campamentos juveniles y los eventos deportivos profesionales. Los negocios que se encuentran adentro de un edificio también podrán reabrir, aunque con una capacidad limitada. Las clases de verano también podrán reanudarse con distanciamiento social, aunque ningún distrito escolar del área ha realizado un anuncio en cuanto a las clases. Los gimnasios también han reabierto, pero quiero recordarles que los clientes también tienen reglas que seguir, no solo los negocios. Si usted ve un negocio que no está siguiendo las reglas, puede usted darle información. Es importante estar informado en cuanto a las reglas. Esperamos contar con más recursos para poder tener los resultados de las pruebas lo más rápido posible. La toma de especímenes va a continuar y estoy consciente de que los resultados en ocasiones no están siendo muy rápidos, pero estamos haciendo lo posible por tenerlo lo más rápido posible con la ayuda del Hospital Spawn. Continúa practicando todas las reglas de sanidad. Existen varios condados en el estado que no han podido reabrir debido a los altos niveles de casos y a los brotes recientes. Espero que mantenga a su familia segura.
Good afternoon, Mayor Joe McComb. As I was coming down the crosstown today to come to this briefing at 5 o'clock, it reminded me things change, and sometimes they change forever. And I'm speaking of the Leopard Street exit coming off the Crosstown Expressway. I've been taking that exit for, well, I won't venture how many years, but it's closed, never be open again. But that doesn't mean we can't get to Leopard Street or we can't continue to use the freeway or expressway. Things change, and I think that's what we're experiencing now with this coronavirus, is that things are changing. We may not do certain things the way we've been doing them for years and years, but that doesn't mean we can't continue to move forward and make progress. May 22nd through 25th is Memorial Day. It's going to be a big weekend for a lot of families. It's a significant weekend in our country's history. And it's a time that we give thanks and remembrance of those that gave their lives for us in the battlefield. We've got people in the battlefield today in the medical profession, here on our own soil, working to keep us alive and healthy. And we need to help them continue that fight and contribute to their success. And so this week is going to be a very important week. And when I see May 22nd, I'm reminded that it's an important week in my life. Well, I've been experiencing our 49th wedding anniversary this Friday. So, Mary, if you're watching, happy anniversary. But as part of that celebration of life and living is that the way we do that is, as you've been reminded in the past, and we'll continue to do that, is that we want to make sure that we're safe and we're healthy, and that's just, keep doing the things we've suggested that you do. Wash your hands, keep your distance, behave yourself, and if you're sick, stay away from healthy people, and if you're healthy, stay away from sick people. And so we would ask you to continue that, and as we continue to move forward and open up our economy more and more, that's going to become even more important. But be a good neighbor and be a good citizen. I'm extremely pleased with the reports that we've been able to compile in Nueces County over this period of time when we're fighting the coronavirus. As a result of the tests that we've conducted to date, 7,036, with a total number of positive reports of tests 248. That gives us a 3.524 percentage test to positives. And that's significant. I don't know whether you've got the chart up here, but you can see this is Nueces County. Bexar County is at 3, Webb County is at 11, and the state of Texas overall is 6.7. So we are significantly below the state average and some of the other cities within our state. And we're very proud of that, and part of that, the majority of that goes to a couple of things. One, we're doing some significant testing, and two, we've got a population in our area that really, I think, for the most part, has bought into the suggestions that we've made, and we want to continue to ask you to keep doing that. And that's our best weapon. We can offer medicines. We don't have a vaccine, but we offer a lot of things. But behaving yourself, doing proper things, being considerate of others doesn't cost anybody anything, and it could save a lot of people a lot of time and a lot of money and a lot of energy. We're also going to be changing, beginning, as you know, I mentioned Memorial Day. Well, Memorial Day actually is Monday, which is a city holiday and a county holiday and a holiday nationally, which means the city hall will be closed. And so what we're going to be doing beginning next week is these 5 o'clock briefings will be reduced to 1 day a week, and that's at 5 o'clock. The other days of the week, you'll continue to get the updates on the numbers and the statistics from City Manager Zanoni. And of course, Annette and the judge and I, and anybody else that you want to ask a question to, you can simply pick up the phone and talk to us. But for those of you that are watching, this may be an informative thing to you, but what you may not realize is the amount of time it takes to prepare to come and provide all of this information. Annette's got to leave her work at the health district. The judge has to leave her work at the courthouse. The city manager has to leave his work here at City Hall. And we come back because, as the mayor, I'm not a full-time employee, so I come back to these things. And it just takes a lot of personnel time to produce one of these briefings. But the information that you're getting is being texted out to the media, and we will continue to do that because we think it's important. But we're going to narrow these meetings down to 1 a week beginning next Wednesday. So we'll continue with this week through Friday, and then next week you'll have Monday off, Tuesday off, and then Wednesday you'll be back. And so some of you folks that come up every day with your cameras, you may appreciate that few days off too. I don't know. But we continue to have conversations with big city mayors. We had an 8 o'clock conference call this morning. We discussed the governor's new orders and how it applies to each one of the cities that we represent. And it's very interesting, and I can tell you, I love some of the other cities in the state of Texas, but I wouldn't trade Corpus Christi for any of them. Amarillo is a wonderful town, but while we have a beef processing plant, and some folks were concerned about that, out there they have over 800 cases in one plant, and that's significant. And they've got a problem out in Amarillo, and we want to continue to remember them in our thoughts and our prayers for that community, and just be thankful that we have a very low number of positive responses in our situation here. So be appreciative that you're in Corpus Christi. We've got a lot to offer, and we want people to take advantage of it. And the 22nd is going to be a significant day. People are going to have more and more opportunity to be getting out. It's also a holiday weekend, so that's going to be encouraging to people to get out. But again, remember to follow the rules and pay attention to all that we're doing. And so that would be my message to you today, is that we're making progress. Like I said, coming down the crosstown, the Leopard Street exit is no longer there coming from Padre Island Drive to downtown. So things do change, but you adjust, and we adjust. And that's what we're doing. We're not coming to a screeching halt, parking the car, and sitting there crying about it. You make adjustments in your life and what you do, and that's exactly what we're doing with the coronavirus. And so we'll continue to move forward. The young people will get to start going to camps in a few days. Restaurants and bars will be open. Health facilities will be open. The aquarium's going to become open on May the 22nd. Maybe I'll take my wife there, our anniversary, and we'll get to see some of the fish relaxing. They haven't paid much attention to this whole mess for the last 2 months, so they ought to be rested. But we are making progress. We're going to continue to do this. We're going to continue to test. But at the same time, our goal, the judge has mentioned before, I think, is at least to have 2% of our population tested, and we're pretty close. In round numbers, we're probably about 8,000, I think, is about 2%, isn't it? About 400,000 in Nueces County, 400,000, and we're at 7,000. So we're pretty close to reaching that 2%. And that 3.5 ratio of positives to test given, I think, is significant. We like to get it to 0, but compared to the rest of the state, and like they say, all things are relative, and so we're in very good shape. And you need to be proud of your community and be proud of the leadership that you have and be proud of the first responders and the medical people that have been providing this service and will continue to provide this service to keep us healthy and safe. So as we continue to fight this battle, we appreciate you joining hands with us and maintaining your commitment to staying safe and healthy. Mr. Zanoni.
En resumen, del 22 de mayo al día 25 es el fin de semana memorial para recordar a aquellos veteranos quienes perdieron su vida durante el cumplimiento de su deber. Quiero pedirles que continúen practicando lo que hemos pedido, seguir las reglas de sanidad para mantenerse seguro. Continuaremos realizando la toma de especímenes y afortunadamente los casos positivos en nuestro condado son del 3.5%, comparado a otros condados que alcanzan hasta el 6.5%. Comenzando la próxima semana, estas conferencias se van a reducir a una sola ocasión durante una vez a la semana. Los resultados diarios de la toma de especímenes van a continuar publicándose diariamente en nuestro portal. Continuamos teniendo reuniones con otros alcaldes de las ciudades de Texas discutiendo los casos positivos por el virus. Continuaremos teniendo programas continuaremos teniendo progreso y ya llevamos el 2% de la población a la que se le ha llevado a cabo la prueba. Es importante el número bajo de positivos, pero me gustaría tener un 0.
Okay. Thank you, Gabby. All right, well, that concludes our presentations for today. Myself and Mayor McComb and Annette Rodriguez are here to see if there's any media questions.
Hello.
Hello.
Let me see where to start. I guess, what are the health department's plans for monitoring the 50% capacity rule increase that's happening on Friday in restaurants?
Let's see if Annette has, well, she's coming up. It's going to be a similar plan to what we had on the 25%, which is that we know we have great business leaders in the community, and they have done a great job in working through all aspects of this pandemic. And they've done a great job at making sure the 25% limitation is adhered to. We haven't received many calls at all. We do have our police department that this is something they know they may have to help respond to, and in my working with the police chief, there's been very little need for calls to manage that 25% cap. So we think the same will exist with the 50%. We know we have a great business community. We know that they know what 50% of their maximum capacity is, and we really need to rely on them to help enforce that governor's order. I don't know if Annette wants to add anything beyond that.
So yes, we are working with the restaurants to just make sure that they do abide by the 50% capacity for Friday. Basically, kind of like the judge said, we're not code enforcers currently. We're really trying to help them to think of ways where they can still run their business, but at 50%. The 50% capacity is for inside the restaurant. It doesn't pertain to outside. So again, we're telling them, be creative. If you need to take some tables outside, we're not trying to get you to lose money. We want you to continue to make money and see the economy thrive, but we need for you to be creative in how you can do it and still institute the 6-foot social distancing.
Okay. I guess while you're up here, Annette, is there going to be testing at Trinity Towers this coming week?
They've already done the testing.
done that?
They were all
Okay.
negative.
Sweet. And the daily, are there new positives from the STX/nursing homes?
STX, we had 1 positive today, and nursing homes, I have not seen any positives today.
And are there any other concerns for other housing facilities like homeless shelters, halfway houses, et cetera?
Right. Avalon, we continue to see a couple of positives. I think we had 3 today out of those reported today. So we're still continuing to work with them. They do have a plan. You know, some of those individuals, they're being sent to their homes if they have enough room in their home to be able to handle somebody with COVID-19. So they're doing some things to try to get social distancing as much as possible because they are limited in the capacity or the space that they have in the home.
Right. And are there any other positives at state-supported living centers?
No, not that I'm aware of.
Okay. And this might be more of a question for you, Peter, but about, since we're now limiting these weekly meetings to once a week, how does that affect like the TMU projections? Like, will we still have a presentation from them during that weekly meeting? Do we know?
We'll probably continue to do theirs as a standalone item on Friday, and they'll continue to track this through December, actually, is what they've agreed upon with us. And so there'll be a separate meeting. The one that we had this past Friday did go a little bit long, so we're working with them to try to condense it a little bit for the viewing audience mostly. It's great information. I read the Facebook posts, so the community loves Dr. Bird, and Dr. Tissot, who doesn't speak much, is also a big part of their information. So there'll be a Friday presentation, so they have the whole week's worth of data. And we're still reporting data. We have every day on our website and our dashboard the same information we present here. So Wednesday will be an opportunity to verbally articulate that to the community. But every day, even on the weekends when we're not here presenting, our information is on our website. And we actually do media releases to the media, so it's sent directly to the media. And others that are on that link is a couple thousand people, I think, that get it emailed to them. And then it's placed on our Facebook page as well, so, yeah.
Thank you so much.
Yes.
Mr. Zanoni,
Yes, sir.
with the heat index 105 today, and we predicting more heat, any senior centers, are you guys looking at opening up senior centers for the elderly who don't have air conditioners at their homes?
Yeah, so I haven't been outside yet today, but is it that hot, 105 out there?
Heat index.
Okay, it's a beautiful day from the windows. We have not, we'll have to address that starting tomorrow. My assistant city manager that was here has stepped out, I think. And we'll let us look at that for tomorrow and going forward.
Okay.
We've got to check the governor's orders too to see exactly what we can and can't do. Thank you.
Yes, good afternoon. Thank you so much for a wonderful meal that you give to a lot of population in Corpus Christi. And I just wanted to say that in that time, there were a lot of people from another segment of our population that they have no transportation to get this food. So if it is any way that together you can put a phone call, a phone that a number that they can call, and if they need some food bank together with the Meals on Wheel, which they have a long waiting list, that we can, help these people that have no way to have a transportation to come to get this food.
Okay, we'll look at that. Thank you.
I
Ms.
appreciate
Patel.
it.
Yeah, I
Thank you.
appreciate you telling us that. Thank you. Okay, do we have any other questions from the media? Okay, well, we want to thank the media for being here, for covering this for us. And that concludes our press briefing today. We'll be back here tomorrow. We'll see you then. Thank you.